Hello there, and welcome to the March edition of the Monthly Dose. My name is Cori Ritchey, and I will be your anchor today. On the show today, we investigate how food safety can prevent the next pandemic, how a person is cured with HIV, mask mandates come to a close, and so much more. To start us off, we are jumping into nutrition. March is National Nutrition Month, and to celebrate it, we are joined by Dr. Michael Greger. Power of the Patient anchor Charlotte Grinnell leads nutrition and food safety specialist Dr. Michael Greger through a discussion that touches on nutrition education and doctoral training, the importance of food safety in reference to pandemics, and the importance of good nutrition.
Hi, I'm Charlotte Grinnell, and welcome to Perspectives presented by the Power of the Patient Project. My guest today is Dr. Michael Greger. Dr. Greger is a physician, New York Times bestselling author, and internationally recognized speaker on nutrition, food safety, and public health issues. A founding member and fellow of the American College of Lifestyle Medicine, Dr. Greger is licensed as a general practitioner specializing in clinical nutrition. His latest books, How to Not Die and How Not to Diet, became instant New York Times bestsellers. And his two latest books, How to Survive a Pandemic and How Not to Diet Cookbook, were released in 2020. All proceeds he receives from the sales of his books go to charity. His nonprofit, nutritionfacts.org, is the first science-based, non-commercial website to provide free daily videos and articles on the latest discoveries in nutrition. On their website, it is stated that the goal is to present you and your doctor with the results of the latest and peer-reviewed nutrition and health research presented in a way that is easy to understand. There are more than 2,000 health topics freely available with new videos and articles uploaded almost every day. Dr. Greger has lectured the conference on world affairs, testified before Congress, and was invited as an expert witness in the defense of Oprah Winfrey in the infamous meat defamation trial.
It all started with my grandma. Actually, I was just a kid, and my grandma was sent home in a wheelchair to die. She had diagnosed with end-stage heart disease, already had so many bypass surgeries, basically run out of plumbing at some point. Confined in a wheelchair, crushing chest pain, her life was over at age 65. And then she heard about this guy, Nathan Pritikin, one of our early lifestyle medicine pioneers. And what happened next is actually detailed in Pritikin's biography. It talks about Frances Greger, my grandmother. They wheeled her in, and she walked out. Though she was given her medical death sentence at age 65, thanks to a healthy diet, was able to enjoy another 31 years on this planet until age 96 to continue to enjoy her 6 grandkids, including me. So that's why I went into medicine. That's why I practice lifestyle medicine, why I started nutritionfacts.org, why I wrote How Not to Die, why all the proceeds from all the sales of my books are all donated to charity. I just want to do for everyone's family what Pritikin did for my family. Reasons, but it's true that doctors have a severe nutrition deficiency in education. Doctors just aren't graduate without this powerful tool in the medical toolbox. And part of it is lack of reimbursement. Part of it is time constraints. Certainly, pharmaceutical industry plays a role in medical education and training. You can ask your doctor when's the last time they were taken out to dinner by Big Broccoli. It's probably been a while. But, I think we have a very similar situation kind of to the 1950s with smoking. So back in the 50s, most doctors actually smoked. The American Medical Association was encouraging people to smoke, with actually saying that it's beneficial on balance and that smoking in moderation is healthy. Even though we had decades of science going back to the 1930s linking lung cancer and smoking. And so it wasn't until the 1960s where the first Surgeon General's report came out, and the powers that be officially acknowledged it. But by then, 7,000 studies. They said, you'd think maybe after the first 6,000 studies, it could give people a little heads up or something, but it took 7,000 studies before finally it was acknowledged. But in that time, millions of people died. Even today, smoking kills, cigarettes kill about 500,000 Americans every year. But our diet kills even more. Tobacco has been bumped down to killing number 2 in the United States, and the number 1 killer of Americans now is the American diet. Well, the most important thing is preventing the next pandemic. So there are certainly things we can do to protect ourselves and our families during the current pandemic, but it's a pretty wimpy pandemic as pandemics go, with a case fatality rate, maybe, I don't know, 1 in 250 people who get infected, 1 in 400 people. I mean, that's an exceedingly, I mean, as pandemics go, certainly. So that would categorize it as like a category 1 or 2 pandemic out of the CDC's category 1 through 5 pandemic scale. And so odds are the next pandemic will be worse. And so, the essential question I address in the book is, what can we do to prevent the emergence of future pandemics? And so, as bad as COVID-19 has been, maybe an even greater threat waiting in the wings of chickens. According to the CDC, the leading candidate for the next pandemic after COVID-19 is a bird flu virus by the name of H7N9, which is 100 times deadlier than COVID-19, with a 40% case fatality rate, almost a flip of the coin, killing about the first 600 out of the first 1,500 people that have been infected by it. And so should it acquire easy human-to-human transmissibility, we have the next pandemic, and could truly be devastating to civilization as we know it. So that's why we need to reform the food system before it's too late. When we, overcrowd thousands of animals, beak to beak or snout to snout atop their own waist in these cramped, filthy football field-sized sheds, it's just a breeding ground for disease. The sheer number of animals, the overcrowding, the stress crippling their immune systems, the ammonia from decomposing waste, burning their lungs, lack of fresh air, lack of sunlight. All of these factors together, what you have is kind of the perfect storm environment for the emergence and spread of these so-called super strains of influenza. They're the ones that can use a little social distancing right now. The bottom line is it's not worth risking the lives of millions of people for the sake of cheaper chicken. Oh my God, what could be more important than the health and well-being of yourself and your family, right? I mean, regardless of what you want to do. Let's say, all you care about is sports. You got to be healthy. Let's say all you care about is lying on the couch and watching TV. You still got to be healthy, right? You want to live a long time and watch the next season of your stupid reality show. I mean, name one goal in life where being healthy doesn't help, right? I mean, and so however selfish people are, right? They want to, see the grandkids grow up. They want to, whatever it is, whatever goal you have in your life, health and longevity are the way to go. And that's why there is these massive industries trying to parasitize on people's fears, whether it's the diet industry or the processed food industry. I mean, they know people are desperate for information on this, and so they're willing to throw all sorts of profitable garbage in people's direction. That's why, with so much nutritional noise and nonsense out there, I just want there to finally be an evidence-based source to kind of cut through all the garbage. And so, nutritionfacts.org is non-commercial. We don't accept, corporate donations. Everything's free. We're not selling anything. It's a non-commercial site. Because if there's ever a decision to be made based on the best available balance of evidence, it should be the decisions about our health and well-being and that of our family. And so it's so important. That's what we need objective evidence about. And so that's why I think so many people are attracted to this work. There's lots of things we can do it's not all or nothing. It's not black or white. Any movement we can make towards improving our health can have a significant benefit. So for example, if there were just 3 things to add to your diet, it would be some kind of legumes like beans, split peas, chickpeas, and lentils, like eating hummus. Number 2 would be eating dark green leafy vegetables, the healthiest vegetables. Number 3 would be eating berries every day, the healthiest fruits. If you just did those 3 things, beans, berries, greens, that would go a long way towards improving one's health. And if there was just 3 things to first eliminate from your diet, would be trans fats, which thankfully are being eliminated from the food supply. Two would be processed meats, bacon, ham, hot dogs, lunch meat, sausage, which are known human carcinogens, meaning we know they cause cancer in people. Mm-hmm. And number three would be liquid candy, soda, sugar sweetened beverages. So you just add those three, get rid of those three, and you're already well on your way.
The first mixed-race person was cured of HIV this week using a new treatment that could potentially help many people of racially diverse backgrounds. She is the third person ever to be cured. The treatment worked with stem cells retrieved from umbilical cord blood, which does not need to be directly matched to the person's racial background the same way previously used bone marrow treatments do. The cord blood donation came from a person with a mutation that blocks HIV from entering cells. Scientists are not entirely sure why these cells work so well, but umbilical cord blood is much more accessible than adult stem cells used in bone marrow treatment, which were used to cure the first two patients of HIV. At this moment, nearly 38 million people around the world are living with HIV. Mask mandates around the country are ending as case numbers continue to spiral downwards. Major cities such as Washington, D.C. are ending their indoor mask mandates. Many states, including Massachusetts, Virginia, Maryland, New Jersey, New Mexico, Pennsylvania, and Connecticut, have either ended statewide school mask mandates or have scheduled a date to which the requirement will end. Coronavirus cases have dropped 66% in the last 14 days as we reach warmer months and virus season diminishes. That's all for this edition of the Monthly Dose. My name is Cori Ritchey. Until next time, cheers.